Let's discuss the Sun-Simiao ghost point. LI11, human, J1. Pull at the foot, Chi-Chua, LI11. Location with the elbow flexed on the lateral end of the elbow crease in a depression between the end of the crease and the lateral epicondyle of the humerus. On the extensor carpi radialis longus muscle. How to find? First, with the elbow completely flexed, locate the lateral end of the elbow crease. Next, with the elbow flexed at approximately 90 degrees, palpate for a pressure-sensitive depression in this area on the extensor carpi radialis longus muscle. LI11 is located close to the border of the proximal aspect of the ulna. Also located at the level of the elbow crease are lung 5, P3, radial ulnar of the tendon of the biceps, and part 3 with the elbow completely flexed at the medial end of the cubital crease. Needling vertically 1 to 1.5 June. Actions indications: clears heat, expels wind. Clears yang min, fire. Pulls the blood, drains dampness, alleviates itching, opens the channel. Special features: Lucy point, earth point, tonification point, Sun-Simiao ghost point, Madan-Yang heavenly star point. Important point for heart conditions and disorders of the upper extremity. Very important point for skin diseases both from blood heat and damp heat. Important point to clear heat in general. Frequently used for channel and joint problems of the arm in painful obstruction syndrome, V syndrome, sequelae of wind stroke, and atrophy syndrome. Like LI5, it is able to clear yang min, fire, which transmits to the heart and spirit, and it's indicated for agitation and oppression of the chest, mania disorder, and tongue thrusting. For this reason, under its alternative name of ghost leg, LI11 was included by the Sun-Simiao among his 13 ghost points for the treatment of mania disorder and epilepsy. Earth point, tonification point, Lucy, antique autumn point, ghost point, Madan-Yang, heavenly star point, metal precision point. This valuable tonification point can strongly invigorate the meridian. It can be considered for problems in the face, example, eye disorders, especially when accompanied by extreme redness and pain. Earache, toothache, along with LI4 and LI7, bronchitis, and high fever. This point may be effective in cases of chronic constipation, excellent for bringing stability to the LI. It's the earth point. Consider this point before releasing the internal dragons if a degree of possession is suspected. It is a ghost point. For problems of the shoulder, upper arm, and forearm. Haiquan, MHN-37 C-spring. Location: in the center of the frenulum of the tongue between the Jin Yin and Joy Yi. Location: note, the tongue should be rolled back to locate and treat this point. If required, the practitioner should roll the tongue back using a gauze swab or wooden spatula. If the deeper needling method is used, the tongue then rests on the needle with mouth closed. Needling, 0.1 to 0.2 tune or prick to bleed. 1.5 tune directed towards do 15. Actions: clears heat and reduces swelling. Generates fluids, benefits the tongue. Indications: heaviness, swelling, and pain of the tongue. Lotus flower tongue in children, facial paralysis. Wasting and thirsting disorder, vomiting, abdominal pain, diarrhea, hiccup. This point, also known as ghost seal, was included by Sun-Simiao among his 13 ghost points for the treatment of mania disorder and epilepsy. Although not commonly used in modern clinical practice due to its location, it is mainly indicated for acute or recalcitrant disorder of the tongue and for facial paralysis. The spiritual pivot warns against needling this point to excess since it may lead to incessant bleeding and loss of voice.